I'd like to welcome you all to tonight's online meeting. What will be the impact of easing the lockdown on Black, Asian, minority ethnic communities, and why we need a public inquiry? We organised this event because we're concerned that the easing of the lockdown announced by Boris Johnson on the 10th of May will have a disproportionate impact on Black, Asian, minority ethnic communities, and to stress the need for an independent public inquiry into COVID-19 and BAME deaths and infections, similar to the Stephen Lawrence inquiry. Within days of Johnson's announcement, the daughters of BAME key workers that died spoke out against Boris Johnson's easing of the lockdown. London bus driver Greaseman Ranjit Chandrapala died of COVID-19 on the 3rd of May. His daughter Leshi Chandrapala expressed concerns about the easing of the lockdown, forcing more people to use public transport and putting more bus drivers with inadequate PPE at risk. It seems all of the bus drivers that have died of COVID-19 are from BAME communities. Similarly, Oyin Kansola Hani Iloba, the daughter of nurse Ayatolami Ola Alaram, who also died of COVID-19 on the 16th of April, urged people to stick to the government's previous message of stay at home. The case of Belly Mujinga, the woman spat on at Victoria Station, but was not allowed to work away from the general public and sadly died after contracting COVID-19, is a further illustration of why a public inquiry is needed. Meanwhile, reports continue to emerge regarding concerns of BAME doctors and the lack of PPE. The Royal College of Physicians, the RCP, found 48% of all doctors who responded to its survey were either concerned or very concerned for their health, a figure that rose to 76% among BAME doctors. Research by Roger Klein, a research fellow at Middlesex University, specialising in workforce culture and racial discrimination in the health service, has shown that BAME doctors are less likely to be in the most senior positions and less likely to feel safe speaking up about problems in the workplace. He said, BAME hospital staff are less likely to be listened to and more likely to be bullied. In some cases, I've heard that BAME staff have been reorganised to work in COVID areas. Dr. David Grimes, a former consultant physician, said, the government is failing in two ways, failing to identify ethnicity as a risk factor and failing to tell us who is dying and what their ethnicity is. They are dying every day excessively. You could classify it as racism. The Office of National Statistics and Institute for Fiscal Studies revealed that overall, BAME communities were around twice as likely to die, with Black Caribbean people 4 times as likely to die. Interestingly, both studies show that even when age, gender, income, location, and other factors are taken into account, race is a factor in of itself. Figures indicate that overall, 28% of coronavirus deaths were people from BAME communities. The ONS puts the death toll figure at over 55,000, and the Financial Times estimate is higher still at almost 62,000, both much higher than the government's figure. These figures also indicate that between 15,000 and 18,000 people from BAME communities have died. The UK has one of the highest infection rates and per capita death tolls in the entire world. Before the easing of the lockdown, scientists were already warning of a second wave and the death rate potentially soaring to 100,000 with any easing of the lockdown. There are concerns that any further increase in the death and infection rate will continue to disproportionately impact on BAME communities. Reports showed that the R rate had increased towards the end of last week. Alarmingly, an analysis of the government's figures on daily deaths from April the 14th onwards shows that if the previous lockdown with the stay-at-home message had continued, the new daily deaths would have reduced to 0 by around the 7th of June. Many would argue that last week was a strange moment to ease the lockdown and for the wider reopening of schools on the 1st of June. Our first speaker has spoken out relentlessly on COVID-19 and condemned the easing of the lockdown and has called for a public inquiry. I'd like to welcome Belle Ribeiro Addy MP.
Thank you, Sami, and thank you to Stand Up to Racism for being very consistent on this issue and ensuring that it gets the publicity it deserves. I think it's really, really important that we started out and outlined what the situation is in terms of the stats, that we were very, very clear how serious what we're dealing with is. And I think it's really important to note that the Office for National Statistics, before coming up with those figures, actually took into account age measures, self-reported health and disability, and other socio-demographic characteristics. And even then, even after taking into account all of them, Black people were still twice as likely to die from COVID-19 related deaths. And it's important that that is fresh in our minds, because when some of us started to raise the issues of BAME people disproportionately being affected by COVID-19, we were met with these ideas, people saying the virus doesn't know race, it doesn't know class, and all of these things. And whereas in some aspects that is true, it's certainly the case that in this country, all of the issues we have with race and racism have compounded the effects that are being had on our communities in terms of COVID-19. And it's important that we're not reduced, I would say, to a list of biological things that might be happening with us or may happen in our communities, and that we look at more systemic issues. So reducing it to vitamin D levels, reducing it to the prevalence of high blood pressure in African Caribbean community, or actually diabetes in the Asian community. Anything like that is not looking at the issue enough, as the ONS is very, very well spelt out. And overwhelmingly, as we see, as they try to end the lockdown or ease the lockdown, those that are being forced to put their health at risk and go back to work are in low-paid occupations, which is disproportionately done by BAME people. Now, it was disgraceful how the announcement was made for the ease of lockdown. People were told to go back to work, and there were no guidelines in place in terms of what each area, each industry should do in terms of social distancing, and no guidelines and no resources, let's say, for additional PPE for people that had to go back to work. They're just told, go back to work. And with all of that happening, we can see this will only make outcomes worse for BAME people who, I would say, in particular, the medical professions. We see that the BMA did a survey of doctors and nurses and found that they were increasingly BAME doctors and nurses felt increasingly under pressure, in particular the nurses, to be put in situations where they were more likely to contract COVID-19. And we know how institutional racism works. If this is happening in the NHS, imagine what could be happening in other industries. And it's not right that any workplace should have that burden put on them solely, because we know at the end of the day, some employers just want to make profits. And as well as being in lower paid jobs, we're finding that BAME people have issues now where they're more likely to be in situations with 0-hour contracts and just generally unsafe working conditions. And the easing the lockdown is pushing them into this further. Now, you judge any country by how it treats its most vulnerable people. And even though we know all of these figures, even though we know the extent to which BAME people are more likely to actually die from COVID-19, there have been no measures put in place to shield them. Now, nobody's saying that we should have make sure that no BAME people go to work at all. That hasn't been the case with any other shielded group. But when we recognize that there were issues with people who are over a certain age, when we recognize that there were issues with people who had underlying health conditions, actions were quickly taken to put things in place for them and to shield them. That hasn't been done for the BAME community, despite the levels of death and disproportionate effects that we're seeing. And a country that takes these issues seriously, before this, would have known that something like this would happen, because it's not new. It's not new that BAME people have worse health outcomes. And that the kind of eugenicist ideal that it may have something to do with our genetics is also completely false. All of these can be tied back to societal issues, and any government that's looking to solve these issues would have actually put something in place, knowing that, as I said, just as with people who already have underlying health conditions, that certain measures would have to be put in place to protect BAME people, and they haven't done that. And we've joined Stand Up to Racism in calling for an independent inquiry, and I think that's really, really important that we do have this independent inquiry. It's important that the terms of reference of this independent inquiry are broad, that they are as broad as they were for the Lawrence inquiry. I think it was really important to see how much we got out of that Macpherson inquiry, as opposed to now how much we're getting out of the Grenfell inquiry, which is so narrowly focused on just the fire and not a wide range of issues which we were allowed to pick up on previously. Looking properly at institutional racism, looking properly how we can change things. And this inquiry needs to not be just another copy and paste exercise of all the disadvantages in the BAME community. It has to be one that has recommendations for transformational change. It has to be one that's very, very clear on how these things are going to be resourced. Too often we have situations where you have this long list of recommendations, or certain things that are put down in any sort of review or inquiry, and then everybody shrugs their shoulders, says that's really bad, and nobody knows exactly what they're going to do to end this and how it's actually going to be resourced. So we can't have a situation where that is happening. If there is going to be inquiry, it has to be a proper one. It has to be one that has the confidence of the BAME community, and that would obviously mean something that didn't involve Trevor Phillips, for example. But as important as this inquiry is now, we know what the situation is now. It's really, really important that BAME people don't become essentially easing the lockdown fodder for that. And I think if we're not taking measures now to shield the most vulnerable in our particular communities, we're going to see more deaths. And it's more important than ever that the government put down some measures immediately to protect BAME people.
Thank you very much, Belle. The virus doesn't discriminate, but society does. And the virus has exacerbated existing inequalities in society. And thanks for backing the call for an independent public inquiry. And thanks for everything that you do, Belle. You've been brilliant since the start of the year. So I just want to read out a comment from one of our viewers who says that, so Sasha says that Boris Johnson's roadmap means blue-collar workers are being sacrificed. And obviously, as we know, that does mean disproportionately BAME communities. So moving on, the TUC has rightly highlighted that it is against the law for employees to be forced to work in unsafe working conditions. Here to tell us more is TUC Race Equality Officer Wilf Sullivan.
Thanks, Sabi, and thanks for organising this meeting tonight. I want to start off by saying that one of the things that Boris Johnson and the government have been trying to do is to convince everybody that we're all in this together. But the reality is that we're not all in this together. Right from the start, what we have seen is a situation where some workers, those mainly doing office work, working in banking, insurance, those kinds of industries, often better paid than working class people, are able to work from home. And what we've seen is that in manual jobs and service jobs, which are disproportionately, where disproportionately BME staff are employed, people have had to go out to work. People have had to go out to work for two reasons. One is because actually employers out there, some employers out there have been completely unscrupulous in terms of the way that they've decided to operate their businesses, money being the bottom line, and have been prepared to sacrifice their staff on the altar of profits. Secondly, because people are also, many people in that position are also in on 0-hour contracts. on temporary contracts are forced into a position where they need to work to survive. And in thinking about lifting the lockdown, the government should have taken notice of what's happened to those people, because certainly from what we know at the TUC, especially in terms of the high rates of BME deaths, then racism has struck again. Those people that in other industries might have ended up being told to work from home, be shielded because they're on the risk of they've got conditions that are on the list from the health service about who was at risk from coronavirus, have been forced into a situation where they have had to work. Black women who are pregnant, people that have got heart diseases or high blood pressure, where actually risk assessments should have been done about whether or not they should be at work, or whether measures should have been taken to make sure that they're not highly exposed to the virus if they're public facing. None of that has been done. And what's the results? What we see is BME people dying at 4 times the rate of white people. So I think when it comes to the lifting of the lockdown, which in my view has been done in a highly irresponsible way, without planning, without provision being made for people to be able to protect themselves when they're going to work on public transport or at work. There's this idea that employers will somehow be considerate. And when Boris Johnson was asked, well, what if people don't do risk assessments, or employers don't do risk assessments? His attitude was, well, I'm sure, you know, employers will be kind to people. But as we've seen so far, that is not the case. I think one of the things that we're doing at the moment at the TUC, as well as heavily lobbying the government about risk assessments and taking into account BME workers' exposure to coronavirus in the roles that they do in relation to risk assessments, is saying to people, look, you need to be in your union. If your employer is doing risk assessments, you need to be part of the process. And that risk assessment should take into account the things that you're suggesting should happen to reduce your risk at work. Because if that doesn't happen, that's not a real risk assessment. I think clearly one of the things that this has shown is that there, you know, money once again, profit has once again been put before the lives of workers. And that if we're going to have a change, actually we're going to have to organise it for us. The government isn't going to think, oh well, you know, we've seen the error of our ways, and we're going to change, and we're going to shield people, and we're going to put into place procedures that protect people. We're going to have to fight for it. We're going to have to fight for it in our workplaces. We're going to have to fight politically to make sure there's a proper inquiry about what happened during this crisis, what the failures were, and why actually, quite consciously, in my view, government didn't do things that it ought to do and plan to protect people in a proper way. So we've got a major challenge ahead, but that means that, you know, everybody is going to have to get involved and get active around making sure we get justice for what's happened. Thank you.
Thank you very much, Wilf. So easing the lockdown has meant racism has struck again. Powerful words there from TUC Race Equality Officer Wilf Sullivan. So I just want to read out a few more comments from our viewers. So shout out to Emma Dent Code, who has tuned in, and say solidarity from Kensington, and thanks Belle for all her work on Grenfell. And Sarah from Harlesden in northwest London says that Harlesden has some of the highest levels of COVID-19 deaths in the country, as well as some of the highest levels of poverty. So thank you for that, Sarah. So moving on, So when the government was openly advocating herd immunity, an important group of people lobbying the government to enter the lockdown in the first place were scientists at Imperial College. Many have also argued that the lockdown needed to be strengthened, not eased, with more testing and contact tracing. I'm delighted to welcome our next speaker, who is Imperial College's Professor Azeem Majeed.
Thank you, Sabi. Thank you for inviting me here this evening. It's great to be able to take part in this event. I think yourself, Belle and Wilf have outlined the issues very clearly. We know from prior research that BAME communities have a much higher risk of both complications and death from COVID-19. So about twice as high based on ONS data, even after adjusting for deprivation and other factors. And research using medical records, which takes into account things like diabetes, heart disease, kidney disease, still shows an excess risk of death in people from BAME communities after those factors are all adjusted for in research studies. So there is definitely a clear risk of complications and death in people from BAME communities. So the questions are, how can we protect people once they go back to work? And the first thing to say is that we need very effective contact tracing, testing and isolation of cases. And it's very disappointing that we've struggled so much in the UK to get those in place. So the testing has been very slow to escalate to the level that we need. And even now we're struggling to get the test that we need to ensure that everyone who may have COVID-19 can be diagnosed, can then be isolated and their contacts traced. It's also very disappointing that we've not yet got in place a good contact tracing system. I know the government's trying to work on this, but as yet that's not in place and there's no date yet for when that goes operational. So those two things are essential before lockdown is eased, because without high capacity testing and high capacity contact tracing, we can't identify clusters of cases, trace contacts and suppress infection through isolation of people who may be infected and through isolating their contacts. So it's very disappointing that those things are not yet in place. And I think we need to push the government to get those three things in place as soon as possible, because without them, experience from elsewhere shows if you ease lockdown without testing and contact tracing and isolation, you risk clusters of cases coming back again very quickly. Thinking about other things that can be done in workplaces, we clearly need very good infection control. So that means good cleaning of services, regular hand washing of people who work in areas that where they may be at risk. And also I think the other key thing is wearing face masks. So I'm not clear why the government has not yet made this compulsory, for example, on public transport, as the Mayor of London has called for. So I would make a strong push that wearing face masks or face coverings should be compulsory in public places. Also in workplaces, we need to ensure those are not overcrowded, that people can work in reasonable separation from their colleagues, so they're not at risk of being exposed to infection. And the last point I would make is that we need a strong risk assessment for all staff before they go back to work. We know what is important in terms of poor outcomes for COVID-19. So we know age is a very important risk factor, male sex, coming from a BAME community, and having a health problem like heart disease or diabetes. So employers need to assess their staff for these risk factors, stratify them by their risk of serious disease, and try to cut that risk back by ensuring that those with higher risk levels are given jobs that don't place them at risk of infection, for example, by putting them in back office functions rather than working directly with customers and clients. So there's a long way to go to suppress infection. We must get in place good contact tracing, good testing, good policies for isolation, and ensure that employers really work with their employees to assess their risks of complications and death, and put in place good measures to suppress risk of acquiring infection. Thank you very much, Sabi.
Thank you very much, Azeem Majeed. I'm delighted to have you with us this evening. So I suppose the shocking factor is that the government eased the lockdown without implementing any of those measures that Professor Azeem Majeed mentioned there. So I would like to read out a few more comments before moving on. So Sarah says that her PCS branch is working to ensure her offices do not reopen until it's safe, and they've asked for assurances that BAME colleagues will be safe. So that's excellent. And Jan says that the government is trying to force schools to open on the 1st of June, and lower paid and BAME families will suffer as a result of this. So thank you for those comments. Please keep those coming in. And also I'd like to announce that we've got 550 people watching online at the moment. So that's brilliant. So keep sharing the event on your social media pages, on Facebook in particular, so we can get those numbers up and attract more people to our work. So I'd like to move on to our next speaker. So along with, our next speaker is someone at the Whittington Hospital. We're really delighted to have it's Chioma Okpara, who is an NHS healthcare assistant at the Whittington Hospital. So we're delighted to have Chioma with us. So welcome, Chioma.
Okay. Hello, everyone. Good evening. Good evening, everyone. I don't know. I know it's very dark here. Hope you guys can see my face. Is it very dark? Okay. Thank you very much. I work as a healthcare assistant, and not only that, I'm a temporary staff. I had someone mention really so bad where you work as a low-paid staff and also a 0-hour contract. You find yourself keep going back to work because you need to be paid weekly, or if you don't work, you will not receive any pay. And it's a real shame. And that some of us that are working, you find yourself, if you don't work, you will not receive a pay. If you are sick, there is no pay for you. And the contract we have is a 0 contract hour, and there is no risk assessment among us that are working in this kind of places. It's why this has really affected some of the BAME community people working in NHS, mostly those in a 0 contract, or even those who are working as permanent staff. So I wish they did the test earlier. It would have been of great help. And now they are bagging on us going back to work. There's a need for a high risk assessment to some people that have underlying health issue, mostly those that are of BAME community. Is very important that it should look into what they can do for us. I know that every Thursday they come to clap hand for those working in NHS, but it's not, clapping of hands is not really enough. There's a lot that needs to be done to checkmate all the things that are causing this problem that the BAME community, some of them are dying in this in the COVID-19 pandemic. You know, many of us that are going back working, they're talking about universal credit. Many people have limitation on their visa, and because they have limitation, they are working very hard to give back to the government, like paying for NHS surcharge and paying an home office fee. You know, there is a need for them to revisit. I know the home office are really revisiting, but there are some things they're still insisting on, like NHS surcharge, that we need to pay for it. And we are working for NHS as well. It's very tasking on some of us, really going back, working very hard to see that we pay all this fee. And also some people that have underlying health issue. So there need to be a proper check-in. If we are going back to work, and they need to help us out to make sure everything run properly among our community. Looking at it, if all the BAME communities are taken away from frontline, I don't know how it's going to be. I'm telling you, I don't know how it's going to be. Us not working as carers or helping in the hospital is going to be funny if we're not found there. So something needs to be done seriously to sort this issue out before people even let out in the community. There should be a proper check-in before people are let out in the community to work again. do something about it. The government should do something about it. They shouldn't let people out in the public place like in the buses. It's going to be jam-packed. People working in the hospital and they are not properly checked. The risk is so high. They should do something to put things in order. Thank you very much. Thank you.
Thank you very much for that really brilliant contribution. I mean, I suppose it's something you said, I think, are pretty shocking. But I think you're absolutely right. So if all BAME workers were taken away from the front line, it's difficult to see how the NHS would function, which illustrates the contribution that BAME communities make, and also how sad it is that the communities that sustain the NHS and other sectors are suffering disproportionately. So thank you so much for joining us. It's really delighted to have you with us, and real pleasure to hear from you. So before I move on to our next speaker, so we've had some really great comments coming in. Keep those coming in. So Jan says that the government is trying to force schools to open on the 1st of June, and that's unacceptable. BB says teachers' unions are right to refuse to cooperate with reopening schools until they are safe. And Taranjit says that there should be no return to work until it's safe for BME workers and the community. So thank you for all those very sharp, powerful comments. So moving on, along with other workers, teachers have been on the front line of the coronavirus pandemic. And now a debate is raging about the wider reopening of schools on the 1st of June. Denmark has been mentioned many times by the government and others as a model to follow. However, in the 2 weeks after the schools reopened, infections rose by 60% in Denmark. So we're joined by our next guest to tell us more about the NEU's position on the wider reopening of schools. I'd like to welcome the NEU National Officer for Membership and Equality, Louise Regan.
Hi, Sabi, and thank you very much to Stand Up to Racism for organising this really important event. You are right, we are right at the forefront of challenging the government around the school reopening at the moment. But we, you know, it's been very powerful to hear the other contributions and listen to what people are saying. And I think that we have to take this as a whole picture, because what happens in schools has an impact on the wider society as well. But you know, the NEU has been very clear from the start, really, that we have our 5 tests, and it is essential that the government meet those 5 tests before we begin to look at a wider school reopening. Those 5 tests are around a much lower rate of the disease, a much lower R rate, as the government now refer to it. Testing and contact tracing, which has already been referred to, which we think is really important and is not in place, and measures for social distancing and safety measures in our schools. We need the whole school to have a real clear plan about it, and also protection for the vulnerable. And I think what Belle made a really important point, actually, that we talk about vulnerable groups, or as the government have identified them, but actually when we look at disproportionate rates amongst our Black community, then we have to take that into account as well when we're looking at this. It was interesting that Azeem talked about face masks. There's no mention of face masks being used in schools, and we are really concerned about the safety of our school communities. Just can you hear me, Sabi? It's gone very... Yes,
yeah,
you
I can hear you.
Okay, good. You'd sort of frozen, so I was just checking it wasn't me there frozen. So just in terms of those issues, really, I think it's really important for people to recognise that the things that we are calling for are very difficult to manage in schools. Social distancing with young children is extremely difficult. We are really clear that we have to protect our communities, our wider communities. And I spoke earlier today, and you know, we have people in our communities who are really frightened about the prospect of schools opening without these things being in place. One of the things that I talked to people about earlier today was the fact that once children come back into schools, they're going back into their communities. They will be taking anything that they pick up in those schools back out into their communities and potentially increasing that rate of infection if we are not careful and we do not manage this really well. And of course, once that rate increases, that will have a significant impact on our healthcare system. So again, it's about protecting all of our communities and societies, really. We have raised this with the DFE. We are really concerned. We have pointed out that we want a real clear plan of health and safety for our Black educators, the parents, carers and children and young people, and what is happening for them and our communities. And, you know, I think people have talked about a public inquiry. I think an inquiry into what has happened during this crisis and the disproportionate impact on our Black communities is absolutely essential. It is essential for those communities to get a good understanding of why that has happened, but it is essential for us going forward in a just and fair society, really. And actually, we need to start some of that work now. We have to understand why this is happening so that we can start to deal with that and ensure that that's very clear in any risk assessments for people going back out into wider society once this lockdown starts to ease, because we have to protect all of the people within our communities and we have a duty to do that, really. And it's really good to hear that people are anxious and concerned about the school opening. We will continue as a union to say that schools should only reopen when it is safe, and we have got the evidence that it is safe to do. We are working really well with our members. We have a big increase in membership. We've had very active engagement of our members, very big meetings. We had 20,000 members on a call yesterday. So it shows that people are interested in hearing what is happening, are concerned about what is happening in their schools and want to engage with this. But we also know that parents are extremely concerned and that they want to be sure that their children and their community are going to be safe if they return. So, you know, I think it's clear we have to make sure those 5 tests are met. We have to call for an independent public inquiry that people can have confidence in going forward. But we have to learn from this. You know, there is a clear evidence that disadvantage has had a massive impact, and that disadvantage hasn't come about because of COVID-19. It's come about because of government policies, and we have to continue to fight for equality in our society across the board and to take people out of poverty. So thank you very much for inviting me. I'm really enjoying listening to other people's contributions, and I will look forward to continue working with you and continue taking forward your message and the good work you're doing.
Thank you so much, Louise. That was a brilliant contribution, and very best of luck to Louise and all our friends at the NEU with the negotiations with the government. Certainly, we support the NEU's 5 tests, and they haven't been met. And perhaps in particular, at the moment, the infection rate and the death rate is way too high to be reopening the schools on a wider basis on the 1st of June. I also want to draw attention to a really brilliant document that the NEU has produced on what you need to know about racial disparities and COVID-19. It's on the NEU's Twitter feed, it's on their website. So it's a really excellent 10-point document. So we've also had lots of comments from teachers and parents and people that are concerned about the schools reopening. It's such a big issue for everyone, I think, including me as a parent. I wouldn't send my child to school at the moment, or certainly not on the 1st of June. So shout out to Louise Raw, who says that Eton, Harrow and Winchester schools, plus schools in Wales, Scotland and Ireland are all staying closed. And even Tory Solihull Council are saying that in order to stay safe, the reopening on the 1st of June can't be done. So excellent points there from Louise. Henry says we must hold the government to account on testing, and the debate should be about testing. And another important point from Sam, who says that schools should risk assess for BAME children who are disproportionately affected by this very worrying post-COVID-19 inflammatory illness, especially in cities with high BAME populations. I think that's another factor why we should all be worried about the wider reopening of schools on the 1st of June. This inflammatory illness that is disproportionately affecting children should actually worry anyone that is concerned about the health and safety of children. So thank you for all those comments. Please keep those coming in. I'd now like to move on to our next speaker, who I'm sure a lot of you know very well indeed. He needs very little introduction. He is the co-convener of Stand Up to Racism, along with myself. I'd like to welcome Wayman Bennett.
Thank you, Sabi, and thank you for all the other speakers. But what I want to make clear is the real question we have to do is the R number. The R number, the government says, is the relationship between the people that get infected, but the R number is also to do with racism, which is at the heart of the explanation of why there's disproportionate amounts of deaths amongst Black and BAME communities. And I want to say that when the government says it wants to open up the schools on the 1st of June, we have to ask this question. Is it better that we don't want to lose a day of education, but it's better that we don't lose a day of education? I'd rather not see the loss of a parent or a grandparent and that to be taken seriously. I do not believe that this government in any shape or form has had any understanding about what's happened to the Black community. Why have I said that? Because this government introduced the hostile environment. It introduced the Windrush scandal. It introduced the question of Islamophobia, which they refused to investigate themselves. They are not fit to run the crisis, and they're not fit actually to deal with the question of BAME deaths. There was a young woman on Sky TV today. Her mother was a Rotenda. She died, and she left her child an orphan. She was a health worker who worked for the health service, and she would have been asked to pay extra charges. These are the people that Priti Patel says that are unskilled and are not welcome. I want to make it very clear they are welcome here. Refugees are welcome here. In Germany, a comparative study said that they've dealt better with the crisis because they've tested, they've had PPE, but also they welcomed refugees from Syria, and that was built into their health service, and it made a difference. And we've seen yesterday with the Immigration Act that the government is continuing its process of how it's treated. Malcolm X's anniversary is now in terms of his birthday. And he said this, he said, don't call me a diner if I'm not sitting at the table. One of the things the ONS report showed was part of the reason why so many people lose their lives is because BAME workers at the front line in terms of the jobs, security jobs, bus drivers, they're the front line, and that means that they're people that are suffering disproportionately. What do we want to do about it? We want to have the public inquiry, and we're going to have to fight for this public inquiry, because you just have to look at the caliber of the people in the world that are supposed to lead us. Donald Trump says he's taking drugs. Might actually believe that, but I believe that he claims that he comes up with solutions for problems while at the same time using anti-Chinese racism as a way of explaining what's going wrong in our society. These are the people which our government is allied with. People like Boris Johnson, who, by the way, never apologized for calling people with watermelon smiles and piccaninny grins and calling Muslim women bank robbers. That's the reason why they don't care about our lives. And I think that we should take a leaf out of Rosa Parks, out of the school boycotts. We should boycott sending our children to school unless we know it's safe. We've had to do this before in the past. There was a boycott in Bristol. This is a tradition amongst Black communities when they're faced with disproportionate inequality and they don't get justice. Boycott don't let them take your child to school. Support the teachers, have full solidarity with them until the government comes up with a strategic plan for both testing, planning, how they introduce people to work. At the moment, it's not safe. It's not safe for our children, who are our most precious resource for us. So we should have solidarity with the teachers. Don't tell people to clap and then give them a slap by saying you're going to pay for austerity afterwards as well. Don't clap and then slap. That has been the tradition. 2008, crisis comes, you say you have to tighten the belt, you say you clap for us and then you slap us. I think it's important that we know that we have to resist and stand up and make sure there's a difference. And the difference has got to be organised around that inquiry. We need everybody to draw together to come up with real answers for what's taking place. It will take time. It's the anniversary of the Grenfell inquiry, and we've seen time and time again inquiries that don't actually lead to anything substantial. Let's make sure this is makes a difference for us. So I'm asking all the people to stand in solidarity with all the people that have lost their lives. Remember the dead, but also fight for the livings. Do not let them put profit before people. People are the things that make the difference. So please sign the petition, start a campaign to make sure there's a public inquiry, join that together, and let's make sure that we keep each other safe. It may not be the priority of our government. It may not be the priority of people like Boris Johnson, who, by the way, life was saved by hospitals we kept open. We have to remind ourselves all the time, it's our solidarity that's the key. Solidarity with the teachers, solidarity with ourselves. Let's resist and survive. And I think our watchword is, when they say stay alert, our watchword is stay alive. It's not stay alert, it's stay alive, by making sure that they don't force the schools to open up, and they don't force us to go into dangerous workplaces, and we have that inquiry. Thank you.
Thank you so much, Wayman, and thanks for drawing particular attention to the immigration bill that the government brought back onto the parliamentary agenda yesterday. I like what you said about the government clapping on Thursday and then slapping on the Monday to migrant workers. So that's really awful, the way migrant workers are being treated by this government, who we're relying on during this pandemic. Thanks also, Wayman, for drawing attention to racist attacks on Chinese and East Asian communities since January, which have rocketed. That's very worrying. And I think it's encouraged by people like Donald Trump and others who just stir up racism to distract from their inept response to the crisis and failing to deliver for their population. And finally, I also like what you said about the boycott campaign, that BAME communities should boycott schools and not send their children to schools if the government insists on reopening on the 1st of June. I have to say, I would be in favour of that, because I don't think my daughter would be safe if the schools were forced into a wider reopening on the 1st of June. So thanks very much for that. And before I move on to our next speaker, I just want to say that we have had, most of our comments are people who are either teachers or parents or just people that are concerned about the schools issues. So many people just don't want the schools to be reopened on the 1st of June. So there's a few interesting comments that people have said, which I'd like to read out. So Jenny says that Calderdale Council have just announced that they're advising schools not to reopen on the 1st of June. So that's very interesting. Another council opposing the 1st of June reopening. So we've had a few more comments. So Marlon says, yes, boycott the schools. We've got Becky saying thank you to the NEU for promoting a safe return to school. And Jan says that it's important that the NEU's 5 tests are met before reopening. So thank you for all those. Keep those comments coming in. I think it's very interesting that the schools issue is dominating the comments for this meeting. So I'd now like to welcome our next speaker, who needs very little introduction and has relentlessly fought against racism for decades, when many others conceded to racism. I'd like to welcome Stand Up to Racism's president, Diane Abbott, MP.
Thank you. First of all, I want us to stop and think about the terrible loss of life that we've seen because of the coronavirus crisis. More loss of life than we've ever seen outside of wartime. And of course, a terrible loss of life amongst the Black and minority ethnic community. It's the scale of the loss of life which has forced even the Tories to walk back some of their toxic rhetoric on migration. It hasn't stopped them bringing forward their toxic piece of legislation, but they've now got to talk in a positive way about migrants in a way they never did before. So why are we in this crisis? First and foremost, it's government incompetence. There are a bunch of people who were elected in December. Why have we seen this crisis? It's because of government incompetence. We had a bunch of people who were elected in December really to deal with the Brexit issue, and they found themselves facing the greatest public health challenge since the Second World War. And one of the things which has characterized the government's response is they see it as a PR challenge, not an issue about real people and real deaths. So they think that if they can throw around statistics, if they can get through the next 24 hours, it will be fine. And so day after day, they have these press conferences with figures which don't stand up to another day's examination. And we've seen that in practice, whether it's testing, where they failed, whether it's protective equipment, where they've also failed, they have let getting through the next day in PR terms stand in the way of really engaging with what they should be doing and their own failures. So why have Black and minority ethnic people been hit so hard? It's partly because of our sectoral distribution in the labour market. We are overrepresented in areas like transport, as care workers in the NHS. And in those areas, we find ourselves very much at the bottom of the ladder. Some people, there are BAME people that make their way through, but generally, ever since my mother came to this country and fitted as a nurse, you find BAME people at the bottom of the ladder. So our sectoral distribution, which has often left us more exposed to infection by coronavirus, the numbers of bus drivers that have died, the numbers of care workers and nurses. Of the 23 doctors that have died from coronavirus, the 23 NHS doctors, 22 are Black and minority ethnic. So it's a sectoral distribution, it's job insecurity. A lot of these workers are on 0-hour contracts, they're agency workers, and they often didn't feel confident to query their lack of proper protective equipment. So what do we do going forward? We have to demand an independent public inquiry, and a public inquiry that makes a difference, a public inquiry that is transformative, which has the right people leading it and the right people advising it. We have to defend school communities. The way the Tories have attacked teachers has been quite, and the Tory press, the way the Tories and Tory press have attacked teachers has been quite extraordinary. Trying to make out that teachers don't want to go back to work and never want children to go back to school. Teachers are working, schools are open, teachers are working. And of course, we all want children to go back to school, but not until it is safe. So we have to defend the school community. We have to call out these bogus comparisons to countries which have a far lower death rate than we have. And we're going to have to, in the near future, organise against the public sector cuts, which will be the consequence of the money that has been splashed out to support British business, because those public sector cuts, apart from anything else, will help working people, and BAME working people the hardest. So this is a tremendous death toll. It has revealed the structural inequalities and the racial inequalities. We have to support each other, we have to support school communities, and we have to realise that there is a campaign that we're going to have to fight. And as Wayman said, remember the dead, but fight for the living. Thank you.
Thank you so much, Diane Abbott. So I think very powerful messages there from Diane Abbott. So we have to remember the massive loss of life that the COVID-19 has had, especially here in the UK, with one of the highest per capita death tolls. We have to support the teachers in the couple of weeks ahead. And we absolutely must have a public inquiry with the right people leading it that's just as transformative as the Stephen Lawrence inquiry was when it comes to race relations in Britain. So I want to read out a few more brilliant comments from our viewers. So Shirley says we have to stop the hostile environment operating in the NHS. Kevin says solidarity and much love to Diane Abbott. And Margaret says we need a meaningful public inquiry that remembers the dead, and we have to fight for the living now. And Sarah says that children must be safe, so our unions must support keeping schools closed. And Uzo says, thank you so much for speaking out on this topic. So thank you to everyone who has contributed there. Please keep those comments coming in. I'll try and squeeze a few more in before we end tonight's online rally. So our final guest tonight is a former editor and US correspondent at The Guardian. He's author of numerous books, including The Story Behind Dr. Martin Luther King Jr.'s Speech. He's been a long-standing anti-racist for decades. I'm very pleased to welcome Gary Younge.
Thank you, Sabi. Yeah, I mean, as a parent who has been at home with my kids for the last couple of months, I am desperate for them to go to school. Of course I am. And the notion that there should be some kind of false dichotomy between my children going to school and my children being safe is obscene. And so I'm immensely grateful to the unions for stepping up on that fight. I want my kids to go to school, but I don't want them, first of all, coming back with COVID. And secondly, I don't want them spreading it. I don't want them, you know, I want my kids to be safe and I want them to be educated. We are supposed to be a developed Western nation. That does not seem unreasonable. Now, seeing the disproportionate number of BAME people who have been affected by this has reminded me of covering Hurricane Katrina in 2005. Katrina didn't create the disparities that we saw in America as the dead black floated up main streets and stood on rooftops and basically had to wait to be saved or died in absolutely disproportionate numbers. It wasn't nature that targeted them. Being black there was a pre-existing condition and it made them more vulnerable. They were more poor. That meant they couldn't get out of town in time. They didn't have a car. They didn't have cash for a motel. They lived in the most precarious areas. And what Katrina did was wash up all of that inequality. And this is what we're seeing with the coronavirus, I think, that it is laying bare the inequalities, the inequities, the racial disparities that have not only existed for a long time, but have been deepened by particularly the party that's running this government and their austerity. And that raises a few points and illustrates a few points. And the first, I think, is it can give us a sharper understanding of what racism is. That racism isn't about bad people saying bad things, though they do exist. One of them's a prime minister. There are many others, but racism is a system. It is a structure. It is not as though this virus is out there looking for black people. It's the society that discriminates, not the virus. And so we have found ourselves and continue to find ourselves, as Diane mentioned, at the bottom of every pile, and therefore more likely to be susceptible. Bangladeshi families 15 times more likely to experience overcrowding in their house than white British households. Pakistanis 8 times, black people 6 times more likely to be deprived, to live in deprived neighborhoods, experience high unemployment, have lower incomes, experience more poverty. And that's what makes us more susceptible to this virus, that we are, as communities, poorer and therefore prone. It's also true that for reasons, historical reasons related to migration, we are in those sectors, health, transport, care work, that where people are more susceptible. But even there, we find ourselves at the bottom of the pile. So we find ourselves more likely to be on 0 hours contracts, more likely to have to go into work, more likely to be delivery drivers, to do all of the things that make us more prone to this disease. And so we don't just fall foul of the law of the land, we fall foul of the law of probabilities. More than 20 years after the Macpherson report, systemic institutional racism continues to dominate our lives. And that raises a couple of questions, I think. First of all, it illustrates who are the key workers. As a group of people, we are derided, particularly if we're also migrants. We are derided, we are dismissed. Diane has had more racial abuse than all the other women MPs put together. We are generally regarded as dispensable. And yet when it comes down to it, we are key. We are key. That without us, the buses don't run, people literally can't live. That racism, British racism, will kill us all, not just black people, but everybody, because there's no NHS without us and there never has been. It's barely a coincidence that Windrush docked in the year that the NHS was created. They have needed us ever since there was an NHS. But it also asks the question, who is this economy for? They keep saying, well, we have to open the schools, we have to do this for the economy. Well, if the economy is going to kill us, then the economy is not for us, is it? And so if it's an economy that works for us, then great, but it can't work for us if we're dead. It can't work for us if we are all sick. It can't work for us, it's not working for us if we are disproportionately poor. And so we have to reclaim the notion that the economy is something out there that is just affecting us as opposed to being part of us. And finally, I think it gives us an opportunity to dislocate or to untangle, for those who are confused, the notion that there is some competition between race and class. There is no competition. We aren't the only people suffering. We are disproportionately suffering. So are old people. So are transport workers. So are health workers. We are part of a coalition, and we can be part of a coalition. And so we don't need to get into a competition about who's having it worse. We have to link up with all of the people who are suffering. When we point out that we are having it worse, one of the things we're pointing out is that poorer people have it worse and we are more likely to be poor. And so there is no competition between race and class in this. And finally, we desperately need a public inquiry. If white people were dying at 4 times the rate of black people in a natural thing like this, it wouldn't be a question. It would not be a question. And so when we consider the slogan, Black Lives Matter, well, here we are, dying in large numbers. Well, there's the test. Do Black Lives Matter? If they do, then this is something that we need to understand. We need a Macpherson scale, Macpherson style public inquiry. I don't trust this government to administer that, and therefore I believe it has to be independent. But this cannot pass as a bump in the road. This cannot pass as I fear Windrush keeps passing, where British citizens are deported and die abroad, having spent their life here, having paid their taxes here, and the government say, oh, and they wait for you to forget and to move on. And that's our job now, to keep the pressure on, this government to address this issue as it connects to other issues, to ensure that we are safe and not to rely on them to keep us safe. If they open the schools, we don't have to go to school. We don't have to send our kids to school. As Wayman pointed out, Black people also have a rich history of teaching our own when the system won't provide. And the system in this moment is not capable of providing. It's in play. It's all in play. And it's not just here, it's in play in the States. Wherever there are poor people, this issue in Brazil, this issue is in play. There is everything to fight for. And so I leave you with a quote from the African-American abolitionist Frederick Douglass, who said, "Power concedes nothing without a demand. It never has, and it never will. The time is now for us to make those demands." Thank you.
That's brilliant. Thank you so much, Gary, for that amazing contribution. So I think what you said was absolutely right. COVID cannot pass as a bump in the road. We need answers, and we have to have a proper public inquiry that is independent and that has terms of reference that actually deal with the issues of racism and discrimination properly. So thank you again for joining us this evening, Gary. I just want to read out a few more comments from our viewers this evening. So Moira says that institutional racism and discrimination must be included in the terms of reference of the public inquiry. That's quite right. And Maria thanks Diane Abbott for highlighting that teachers haven't stopped working, no matter what the Tory press says. I'd like to echo that, because I can tell by the amount of work that my daughter gets sent online that teachers definitely haven't stopped working, and they've been preparing lessons for kids to learn at home and working under very difficult circumstances. And Lizana says that BAME communities are not collateral damage. And a really interesting point, another point from Louise Raw, who said that apparently it's breaking news that another child has died of this new multi-inflammatory syndrome. So yet more worrying evidence which suggests that a wider reopening of the schools on the 1st of June is not safe for children. And finally, I just want to I'll read out two more comments. So Muna says, why are Black women so at risk of COVID-19? She's asking, is it because they are disproportionately frontline workers? I would say they also suffer double discrimination and possibly other forms of discrimination as women and as Black people, and potentially other forms of discrimination. And that's one reason, I think, for the risk that Black women suffer. And Nyla says we are at risk from COVID-19, but also targeted by the police during the crisis. So thank you very much for all of those comments. So that brings this meeting to an end. But before you go, I'd like you to check out our statement that calls for an independent public inquiry and that opposes any easing of the lockdown. So we issued this statement weeks ago, back in April. And look out for more online meetings like this. So you can check out our website for further information. That's www.standuptoracism.org.uk, or check out our Facebook page, which is just Stand Up to Racism, as I'm sure many of you are doing right now. And our Twitter handle is at Anti-Racism Day. So please just check out for more details. And I want you to, I've got one final request, which is please, please, please make a donation to Stand Up to Racism, because racists have rich people like Donald Trump and others that fund their work. But we've got something more powerful and more strong than them, and that is you guys out there. We've got people, and we don't need lots of really big donations. What we want is small donations from lots of people. So please give us what you can, give us what you can afford. That helps us to sustain these online meetings and to keep the campaign going in these very difficult circumstances, because as you've heard this evening, and as you can see, this is a very important issue that we're discussing and that we're drawing attention to. And we've certainly had an impact, because since we called for a public inquiry, many other people have joined that call. So we're certainly having an impact. So the support that you give us does affect things. It does transform, and it does make change. So thank you so much, and have a good evening, and please stay safe. And one final message: please support the teachers, and check out the NEU's website and their social media and other unions. Thank you so much. Good evening.